these are great ideas, but we have to look at the unintended consequences of even the things that we think are great ideas, right?
Welcome back to the Faculty Factory podcast. I'm really happy to introduce to you someone who's new to me, Dr. Sylk Sotto Santiago. Sylk, hello.
Hi, nice meeting you and nice talking to you.
Well, I'm so pleased that you are here, and it is in gratitude to Dr. Laura Schweitzer, who, when I was talking with her, I think she's been on the podcast a couple of times now, I said, who else should we have on? And she said, you have to talk to Sylk Sotto. You have to talk to Sylk. She's the vice chair for Faculty Affairs, Development, and Diversity at Indiana University School of Medicine. And I love Indiana University also for Mary Dankosky, one of my role models in life in faculty affairs and faculty development. So again, Sylk, thank you so much for being here. I'm particularly intrigued and excited about your proposed topics for discussion because they're really unique and they've really not been addressed here on the Faculty Factory podcast. So perhaps you'd like to also introduce yourself in terms of your background, your scientific background, your medical training, and then we'll just launch right into it, however you like to begin.
Okay. Well, yes, indeed. I am vice chair in the Department of Medicine, and I focus on faculty affairs, development, and diversity. I am also an assistant professor of medicine here. I'm in the tenure track, and I'm one of the few Latinas faculty, especially in the tenure track at the School of Medicine. And I mentioned that because I have recently felt that I did experience this notion that I have become my own research. My own research subject. And with that, let me tell you. So I do focus on, I have been in academic medicine for over 20 some years. In different functions. And I actually have been an administrator and recently switched to what I see as this faculty life, really. So I decided to, after many years in academic medicine and higher education, I decided that I was going to go back in my mid-30s and graduate before the age of 40 with this doctorate in higher education. And that is very much motivated by my experiences, not only as an undergrad, in a STEM field and feeling completely lonely, alone and isolated, but also through my career in different graduate programs, different master's programs, and even the doctorate degree. So from the very beginning, my focus has been equity in higher education and academic medicine. So I do the majority of my work is pretty much centered on faculty and professional development. But my other buckets, if you will, are obviously under the umbrella of equity. So I look at inclusive learning environments for UME and GME. I look at organizational leadership and the structural barriers that are there for the advancement, again, of minoritized faculty and students, and then this intersection of research ethics and health equity. So, but like I said, the majority of my work is really focused on faculty and professional development as a discipline, not just, as here we're putting, program together to help faculty advance. I really focus on, especially on Black and Latino and other minoritized faculty in academic medicine and higher education. Because of that, I felt that, there's some really cool things that we're doing in the Department of Medicine, and obviously being one of the largest department at any school of medicine. I think it's something that people might be interested in learning a little bit more. One of the topics is this notion of leading with wellness in mind. And the reason why I brought up that topic is because, especially during the pandemic, I think a lot of academic health centers have really tried to focus on wellness and burnout given the state of affairs, right? Not that burnout and wellness were not an issue before. Obviously, we have been navigating that space for a really, really long time. But especially during the pandemic, it was necessary for us as a department to say, okay, how do we lead not just with wellness in mind, but adding equity, right, to the mix. So we were already operating under an inclusive excellence type of strategic, planning model. But it was really important to think about how do we also lead with wellness in a way that is also role modeling for our faculty, right? That even during the pandemic, we have your back kind of situation. So a lot of things have obviously happened and transpired during the pandemic in support of the faculty, but even discussing with other chief wellness officers, for example, or really thinking about wellness, it felt that it was still a silo aspect, right? That we have to deal with wellness and deal with equity, but it's separately, not together, right? And at the end of the day, it's in the hands of the leaders, right? Like, how do we treat our faculty? How do we put policies and practices in place that really contribute to satisfaction, engagement, vitality of the faculty? So in that sense, we published a paper last year really talking about equity and wellness as being critical in inclusive physician wellness efforts. We used a simple model, right? The Wheel of Life, which is a popular tool and is used in coaching. We trained faculty actually during the pandemic on how to become physician peer coaches, and did all that, but really thinking about the Wheel of Life and the aspects of, again, physical wellness, career, financial, intellectual, social, and other areas of the wheel, and asking the questions about equity, especially when it comes to our minoritized populations and faculty, right? So thinking about career wellness in a way that, are we really engaging in work that provides personal satisfaction, that is consistent with our own values and goals? Examining from that aspect, okay, career wellness. What is the organization's EDI, equity, diversity, and inclusion record when it comes to career, when it comes to satisfaction? Does the organization recognize that signs of minoritized faculty burnout? Under what circumstances they experience these symptoms? And the list goes on and on. So I don't want to rehash the paper, but it's really thinking about all the questions that as leaders we should ask when we are thinking about wellness, and we're thinking in terms of equity. So wellness with equity in mind will really be an aspect that will help us ensure physician longevity, or actually faculty longevity in the academy.
So, Sylka, thank you so much for contributing to the scholarship, first of all. That is really so important. And I love how you led with recognizing faculty development as a discipline. So first of all, again, thank you for the hard work in publishing this work. And you mentioned putting policies and practices into place to marry these concepts, wellness and equity. Can you give us an example of a policy or a practice that you implemented or improved or are noodling around that demonstrates the synergies and the complementarity of those concepts, wellness and equity?
Yeah, I can give you an example. I think that we are in an era that the same way diversity has broadened its meaning, I do feel that we are at a crossroads here where wellness has really also broadened its meaning. That we're not just, I just gave you the example of the Wheel of Life, right? How we're thinking about financial wellness, right? In these larger aspects. I do think that wellness is related to so much of what happens in our daily lives, in our own professional careers. So an example, not necessarily an example of a current policy that will change things, but I can give you an example something that we didn't think that was contributed to financial wellness. So our health system, for example, have quality incentives for patient satisfaction scores.
Sure.
Right. And many places had this, and we decided that sounded good, right? That, more money in the pockets of faculty physicians seemed like a good thing. Everybody was on board. However, after a year of seeing this, we realized that this might not be what the outcome that we wanted, especially when we saw women and faculty physicians of color having lower patient satisfaction scores. All right. And in some instances, we actually look across the department, and this was there. And it was statistically significant, especially when it came to women of color physicians. So what happens with that? The consequences is that we are contributing to the pay inequities, right? We're contributing to the pay gap because these individuals, right, the women faculty, as well as the women faculty of color and other physicians of color, were not receiving the same amount of incentive because of the realities of patient satisfaction scores being so subjective. So we were hurting their financial wellness in a way, right? And we were part of contributing to perpetuating pay gaps that we didn't even recognize when that proposal, right, went into place. Because again, why would you argue against giving money, right, to your faculty? Like, this is great. So again, when we're thinking about let's lead with wellness in mind, let's lead with equity in mind, is that we are thinking, okay, these are great ideas, but we have to look at the unintended consequences of even the things that we think are great ideas, right? So we need to look at the data. We need to make sure that the evidence is there. To make the story short, not that it can be any shorter than this, but that incentive was eliminated because when you look more broadly, it wasn't just the Department of Medicine. We looked at close to 400 faculty physicians. So it was clear that it wasn't really having the impact that the health system had intended. And obviously we endorse an incentive that was flawed.
That is fascinating, just fascinating. And a great reminder to carefully consider and have as many eyes on a document and as many faces at a table to try to troubleshoot and look at those unanticipated consequences and unintended effects or impacts, and just really be avoid the groupthink concept of like, this is fine, it sounds great, how could anybody shoot any holes in this? Until we pause and take a moment and listen to different voices of, well, maybe. So I think that is such an important example, and of leadership and slowing to me, I'm a high J in the Myers-Briggs. So I'm always like, that sounds great. Go ahead, do it, make it happen, make it so. And we need the P's in the group who are more like deliberate. It's okay, slow down. Are we missing any possible thing if we proceed? And that is such a perfect example of well-intentioned and yet some downstream negative effects. So good.
Yeah, I think that's exactly it. When it comes to, and I have thought of this recently as I'm thinking about, impact and culture change in a department, I think I get the greatest joy when I see leaders now, even within the department and other spaces, again, asking the question when these proposals come through or when you're looking at the data, but especially when these proposals come through in terms of problem solving and really being strategic in our initiatives and things like that. I'm very proud when people stop and say, okay, this sounds good. Is it equitable? Does it lead to our faculty wellness? And obviously this is a faculty related podcast, but I'm always also asking the question for our staff or for our students or whatever the space is. I think that is the main lesson. Just ask it. Does this make sense for everyone?
Right. And just you reminded me of a former professor of research at Rush University who always reminded us when we write grants, you play it forward. So when we tell the story and create interest in the hypothesis or the hypotheses, you're playing it forward. How will this play out? How will the project proceed in the timeline? And it's the same or similar, I think, a process where let's play this forward. If we were to implement, let's try to kill it. Where will it go wrong? If it goes wrong, what might it happen? Let's play this forward and do all the levels of if then. And then all of a sudden we could be 7 if then loops deep and go, oh my gosh, we hadn't even thought about the impact on staff, which then has a feedback loop to this, or this current, bumping into the other policy. So I think it's just so smart. Good.
Yes. No, I like what you're saying in terms of play it forward. And now I have to say that I want to make sure that this actually goes on, on the record, if you will. I am not stymieing innovation.
No,
I do think that there are circumstances that, of course, as leaders, we need to act, especially, again, in this period where we have had to combine crisis and transformational leadership, together, that, innovation should not be limited. All I'm saying is that we just ask one more question. I even say this in medical education, right? That I'm not, especially as I'm talking about inclusivity and talking about culturally relevant pedagogies and education development, that I'm not asking for a whole curriculum overhaul. I am just asking for clinician educators to have one more question handy and ask, okay, how would this be different if it was so and so, and just throw out there a different type of example, a different type of situation within structural social determinants of health and things like that. To change the culture, and maybe this is me being idealistic, but I really think that it just takes one or two extra questions to really change minds and make people think, just like you said, just play it a little bit forward and see how it
I love your philosophy, Sylk, and I think it resonates so easily with academic scientists and clinicians because we're all about curiosity. So we love nothing more than pushing our brains and challenging our brains. So it's just another what if, and go, oh, that is true. What if? So it's just so natural for me to be curious. And I think a lot of us, if we take the time to just pause, our brain may light up in new ways and uncover new ways of fill in the blank, interacting with our patients and our colleagues in the lab and in the classrooms and at the bedside and in the clinic with the staff meetings and on and on and on, just by being curious. So
curiosity is certainly very important. I was trying to think of something that you just said also made me think about resilience, right? Obviously, we always bring up resilience when we're talking about the wellness and burnout aspects that are really impacting our faculty, but asking the question or proposing that we lead with wellness and equity in mind, to me, is a way to even counter the focus that we have had in individual resilience. And everybody that knows me knows that, okay, I may be navigating this wellness and burnout world, but I do not put it all on our faculty. That I do appreciate yoga and fitness, memberships and things of that nature. But I do believe that you can work towards individual resiliency without working on institutional resiliency.
Absolutely.
And I think part of having leaders who think about wellness and equity and are asking these questions, that it can only increase institutional resiliency to the point that you can truly still have individual resiliency, but you're really putting the onus on ourselves, organizations, and leaders to actually make the change, right? Make the spaces that we navigate and day in and day out better, right? Leading to, again, that vitality and satisfaction.
Well, we're going to definitely link to your article, Equity and Wellness, a call for more inclusive physician wellness efforts in MedEd, January 2021, right? So we're going to link,
Yeah.
we'll put the link in the Faculty Factory resources tab where we have lots of faculty development literature there. So thank you for, again, contributing and challenging us to be curious and ask questions. One more question, we can do it.
Yes.
So you'll have to excuse my dog barking in the background here. But we have another topic that I was really, really excited for you to go into, if you'd like to lead into that next.
Okay. So yes, I was talking to a couple of individuals. We have done, obviously everybody has heard of writing accountability groups, and accountability groups exist for many things, right? But they're absolutely great, and there's obviously great literature and scholarship supporting that. But a couple of years ago, we started a promotion accountability group, and there's nothing magical about it, which I think that's why it's so transferable to anybody that wants to implement it. There's really no rocket science here. But in looking at our own path for promotion and tenure, and looking at, again, my bias is that I focus on gender and race, ethnicity issues. But in looking at that, obviously, we're not happy with the numbers of women that are going for promotion or for tenure. And also, again, our faculty of color. So we realized that we needed a little bit more of a support system. Many times, again, we're talking about busy clinician scientists and clinician educators and all the tracks. We're just busy. There's no way around it. And there is not enough time to prepare a dossier. And sometimes just the idea of preparing a dossier was the limiting factor, especially for our clinician faculty. Oh my gosh, I have no time to put this together, right?
It's a part-time job. It's a part-time.
Yes. There's no time for doing this. So we broke it down a little bit. I, follow actually the writing accountability group schedule that I have that is about 12 weeks. So with that 12-week schedule, I tell people we're going to come up with an idea, and by week 12, we're submitting that to a journal. That is the whole plan here. So with that thought, looked back at the deadlines and criteria for the school and said, we're going to break this up as we would any project management, any grant. Actually, thinking for those that write grants, they know that you have to pace yourself, right? You can't sit down and write the whole 25 pages or whatever the case is in one sitting. So we offer participation in these. And most recently, we had about 12 individuals that actually joined our promotion accountability group. We worked on every week. We connected and we worked on different parts of that dossier. Okay. So for example, week 1 was the CV. And that actually may have gone to week 3, right? Because, again, many institutions have a particular CV template that they must follow. And that CV template is a pain. There's no other way to say it. Either at Indiana University or University of Colorado or whatever it is. Right?
As well. Oh, yeah.
Right. So really working and helping our faculty, again, get through that CV. The next few weeks were related to the personal statement and providing templates and providing, obviously, examples. But here, this week we're going to work in 2 pages and then the next 2 pages, but really breaking down the dossier in elements of project management. Again, I told you that there was no earth-shattering experience here. However, everybody that participated was able to say, my gosh, I got it done.
Exactly.
Right? I submitted by the deadline. We worked on external referees list, internal referee list. We worked on putting, again, evidence together for publications and journal impact factors and things of that nature. So we really did focus on all the elements of the dossier, breaking it down week by week, so our faculty didn't feel like it was
so big. Yeah.
So big. Now, there's some lessons that I'm happy to share now that we have done it for, I think, 3 years now, that I do believe that we probably need more time, more leeway leading into that deadline, because we're still focused on a 12-week breakdown of parts. And I think that it can go a little bit longer. I also think that the accountability amongst the peers could probably be a little bit better, right? And having some space, not just Microsoft Teams or something else, but having some sort of platform where people can really track their progress and see how each other does would have been great. But yeah, that's the promotion accountability group. Like, how do we break this dossier? How do we break down this promotion and tenure preparation in ways that are little nuggets that are manageable for very busy faculty, so they're not overwhelmed?
Super, super smart. And I love how you use the WAG model. When we put WAGs together, it was something you talked about earlier. The primary purpose was to make it was a tool that I built it on the How to Write a Lot, Paul Sylvia.
Yes.
He had, he had a process, but there was no structure. So when we put the WAGs together, this is the structure of how you implement the process of getting into a regular routine and habit of writing. So when we did this, I was Karma Fouché, my mentee back at Rush University Medical Center in Chicago. It was, again, an idea of putting a structure that would get into a good habit of writing with increased regularity, increased frequency for shorter durations, which is sustainable. But what you mentioned earlier, an unanticipated benefit was the socialization and the networking.
Absolutely.
And the fact that I'm not alone, that I'm in this together. And that's the accountability portion of it. So I think it's genius that you use that same approach of dedicating time, putting it in your calendar, having explicit expectations, and then being accountable to each other to deliver on the product that you promise you're going to do. So I think it just makes so much sense. So congratulations. That's super exciting.
Well, thank you. I think at the end of the day, I will measure the success as long as all the 20 some individuals that are going up for promotion actually get promoted and positive votes. But again, this is also an effort as vice chair anyway, right, to also increase the quality of the materials that are submitted to, promotion and tenure committees, making sure that we are selling our faculty to the best of their abilities, and making sure
faculty, feel like it's a process that they can control. It is doable. It's manageable. You've put into place a nice structure that kind of blows open the mysterious black box component of it.
Yes.
This is how we do it. And then you're not alone. It's not such a humongous thing where I have to spend the next 8 weekends or 12 weekends of my life by myself trying to figure this out. It just makes some sense to support each other. So I think it's a wonderful idea. Promotion accountability groups. Fantastic.
Awesome.
Thank you. Dr. Sotto, you have a third suggested topic, which I thought was so cool. So you celebrate something every year in your department, which is really unique. So tell us what that thing you celebrate is.
So we actually have talked about this topic also during a AAMC meeting a few years ago. One of our fellows at the time pulmonary and critical care, Dr. Erin Crowley, just in case she's listening to the podcast, was talking to a couple of us, Dr. Katie Sears, Dr. Cindy Brown, and myself, and just a little bit down, right? It was one of those conversations of, hey, how are you? And it was I can't remember specifically, but it was either my paper didn't get accepted or, here is another grant submission that,
was unscored.
wasn't scored or something like that, right? And, during the period of that conversation, the eternal cheerleader that I am, I said, this is cool. I mean, you submitted a paper, we should celebrate that. Or, you submitted a grant, we should celebrate that. All that is part of the process. And Dr. Brown, Dr. Sears are also cheerleaders, and they also share, their own instances during that particular, few months. Like, okay, well, my grant got scored again, right? So it's this notion of all the things that we had failed at, but in our minds, right, that we had failed at during those moments in that conversation. And I am also Puerto Rican, so I love a good party. So the decision was to say, we should celebrate these. We should celebrate all of our failures and change the narrative, because especially in academia, I think that we see these indeed as failures, especially when we compare to, our peers, or colleagues that are in the same rank in the same year, or, things of that nature, without realizing that this is unfortunately, right, part of the process, part of getting the next paper accepted although I have never had a paper accepted in the first review, but, again, part of the process, right, of getting ourselves better in grant writing, getting ourselves better in, papers, et cetera. So we decided that we were going to introduce the concept of, and we joked about, let's just hashtag FailFest and make it happen. So that's actually
Fail Fest. I love it.
So that's what we did in our first celebration of hashtag FailFest.
And did you have Mofongo? That's what I want to know.
No, I didn't.
Mofongo at FailFest.
We did. I did not cook. I was not responsible for the cooking. I'm just responsible for the organizing the parties, No, so for our next Women in Medicine group, we decided, we're going to celebrate hashtag FailFest. Come prepared to share the failures, and we provided examples, that, have happened in the last year. And we will just, have a conversation about it. And that's what we did. We had a really good turnout. And as a product of that, we actually collected a list of things that we were doing to deal or to cope with these failures. Lessons from, never open a grant review on Friday at 3:00. Like, do not do that. Just save it for Monday. To I went shopping for shoes, right? That whole list of things were there, and it was wonderful. The other aspect that I think that is very interesting is that, we framed it from a professional standpoint, right? Like from the academic side, but inevitably, it turned more personal, right? You provide examples of, one time I sent my daughter with different shoes to kindergarten. Right? She, luckily in my case, it was like a navy blue and a black, shoe, but I knew, and I felt like a terrible parent, but nobody else noticed that she was wearing navy blue and black, black shoe. But the point that I'm trying to make is that for a lot of us, especially in terms of motherhood, it was an opportunity to connect again, how we were perceived, how we perceived ourselves. We were failing in other spheres of our identities, right? That it wasn't just professional. So we have done it, I think, for 4 years now. that we celebrate, Fail Fest. And actually the last one was recently in the fall of 2021. And I do remember early career faculty saying, oh my gosh, I've never participated in this. And it's so nice to hear all of you, especially, mid and senior faculty talk about, the failures in this. So I think that it has also worked out as inspiration for the early career faculty, again, changing the narrative. That's the bottom line. We wanted to add the fast part in order to change the narrative that these things are not necessarily failures, but part of the process, and how we grow as faculty and professionals in our careers.
Oh,
does that make sense at all?
Look, it's wonderful. It's so fun. It's such a great twist on things, since we're so accustomed to celebrating with awards of, you got the grant, you got the paper, you got the leadership role, you got the promotion. So celebrate all these things. And then other faculty members who are struggling or starting off or confused or going through seasons of life, social comparison. We compare ourselves and say, I'm inadequate. I'm never going to be that, or what's wrong with me, or I'm not going to succeed. And so that honesty of seeing someone's failures, or the anti-CV, if you will, look at Sylk Sotto's resume. I would never have all that. I'll never be there, without realizing, well, if you saw the anti-CV, if you saw all the things that were rejected, or how many journals this paper went to go be a foster child, how many failed fostering attempts this paper had of these families, and how many grants I submitted. Yeah, you see how that I got these 10 funded, but I got 100.
That we're not.
We never about that. So I love that you don't only acknowledge it, you celebrate it.
Yes, you have to celebrate it, right? Like, it's all part of the process. But I'm glad that you bring up the anti-CV, because I think we saw it maybe in the second year of our celebration, and we actually discussed it. It was just so much easier to just sit in a room with people, have our snack and our beverage. I will not relay if they were alcoholic or not alcoholic, but to actually say, listen, I put my name for a board of directors, and that I wasn't selected. Well, what does that mean? Like, kudos to you. You are actually putting yourself out there for big roles, and now you know what the interview is like in the process, and when are you going to apply to the next one?
That's
right? So having exactly a community of individuals that are in the same boat, but also cheering you on to the next thing. We have been there. So what's the next thing? What are you going to do?
I love how you're emphasizing the underlining the fact that these failures are learning opportunities. And
Absolutely.
That, this didn't work out. And then what happened? So I'd love to hear the next, and then you won't believe it happened. I didn't get that position, but then lo and behold, about 9 months later, the old Paul Hart, you're too young for this, but the old Paul Harvey, and now you know the rest of the story. There's, once upon a time, and the story marches along, and then all of a sudden, a twist comes up and you go, oh my gosh, I never knew. And he's like, aha, now you know the rest of the story. So it starts off as a wah, wah, wah. And then now I know why that got rejected, or I didn't get that board appointment, or I didn't get that promotion, because had I had that, I probably wouldn't have been in a position to get this. And now like maybe
it all,
barking. Now I know why I got rejected during COVID of so many dogs I applied for on Pet Finder to get. No. It's because I was going to get this little guy, and he's perfect.
So well, I'm glad you went through that experience, because now you value that little guy a little bit more. I think it was at one of AAMC meetings years ago. I can't remember which one or who said it, so maybe somebody that is listening to this can claim it. But I was talking to somebody, and they were telling me that they met someone who had their paper published in a very high impact, journal. I don't know if it was New England or Science or Nature or whatever the case is. And she actually said it had been rejected. I think it was 8 times.
Oh,
And each time, from the beginning, people just rejected with no comments. And then as modifications happened, there were some more comments and it made the paper better, to the point that then, it gets accepted to a major journal. So since then, the kind of joke is, but has it been rejected 8 times? So
it's
I have
going to make it to Fail Fest unless you only got rejected once.
one time. Are you kidding me? 2, 3 times? That is amateur right there. Like, you tell me. So even at a personal level, 8 is my number, and after that, I say, okay, it's time to put it in a blog or something. Like, where do I send this thing?
I like it. It's got to be Sylk Fail Fest Fight Club. It's got to be hashtag Fail Fest Fight Club, where the number one rule is we don't talk about the failures.
Yeah.
Silly nonsense of like, oh, you have to be a special elite member to get to the Fail Fest Fight Club level. You got to be rejected 8 times. Then you get the special award.
Then, yes, it will be like SNL wearing like the 5th time they host jacket.
Yeah,
we should have. It was rejected 8 times. Here I am, kind of thing.
Come on, talk about warrior. Just this is how you do it. You don't give up. You learn. You persevere. And to watch someone keep getting up off of the mat. I'm not giving up. I'm not giving up. Like, I've had a friend. I see what happened. I got a paper. It was like journal number 4 or 5, and I just sits forwarded the email, ranting, raving, bang, 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 bang on the keyboard, blah, 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 blah. I was just so angry. And she was just like, Kim, calm down. Don't give up. And she was going into, coaching mode. And I was like, oh, come on. You know me. I just need to
yes.
Rage against the machine. I needed a week, 10 days to kind of like go, whew.
Yeah.
And I'm like, oh yeah, this is not. I'm going to get this published in the National Enquirer if I have to. It's getting published, baby.
That's actually how I go. Like, somebody needs to hear about this. So let's just figure it out. But something that you just made me think, right? In thinking about the warriors, right? Thinking about perseverance and thinking about all those things. I do want to note that you can still, again, cheer people on while recognizing the barriers, right? The structures that also do not allow us to get this work done. I say that because, especially living, maybe not so much in the last 2 years, right, when a lot of shifting has happened towards diversity, equity, and inclusion. But at the beginning, like, who wanted to read my papers about the experiences of Black and Latino faculty in higher ed? They made it. They're faculty, right? So now there is a shift, but there are still, moments when, for example, there's a very well-known journal that I always start with, right? It's like, okay, this is the first start. We'll see what happens there. But, that journal actually tells you the name of the individual that is submitting, tells you the institution. When you're a reviewer, you see those things. And those are problems in the systems, right, that we have when we don't have blinded review, when we allow biases of, the institution come into play or the eliteness maybe of the institution. So I think that we can still say, yes, there's room for us to improve on our writing. There's still the fight and the perseverance to get that paper published, but also know,
right,
that the system is flawed, that higher education is flawed,
right,
that peer reviewed is still a flawed process in many ways, and that some journals haven't even tried to, fix some of these things, especially, again, when you talk about certain topics like diversity, equity, and inclusion, in my case. But yeah, that there's all these little bit morsels of bias that exist in the system that may not allow for that. Again, talking about NIH grants, you can still recognize and acknowledge that, right, that 80% of the funding goes to the same institutions or the same PIs kind of thing. And I'm throwing numbers out there, so I don't want anybody to quote me in the podcast with these numbers, but they're pretty close and you can actually look for them. But, like there's still room to state that we are all playing a game in many ways, and some of us don't even know the rules of the game. So we're in this together, and that is all part of those fail-fast conversations. Is that fair to say, Kim?
It is extraordinarily fair, and I think it's so refreshing to hear your perspective, to learn from you, and is such a great reminder. Of course, our institutions, of course, our systems, of course, our processes in journals are flawed. Because why? Because they're run by humans, and we are flawed, and we beautifully flawed. We're wonderfully flawed, and it's not being. I like you. There's a sensibility of not maligning and burning the house down, as much as a recognition of there is room for improvement.
Yes,
at
absolutely.
The micro level, like you said. I have to own where I have gaps in my character, my writing, my leadership, and I will work on that. And my division, department, school, university, community, neighborhood, region, country, state, country, on and on and on and on. We all have this responsibility on all sides to have that moment of, is this equitable? For fill in the blank, any diversity in the broadest sense. So that to me is that question of, let's all take a moment and pause and reflect and be curious. And it will do nothing but help us. So.
Yep.
Oh my gosh, I so enjoyed our conversation. Everybody, I'm sure you too have learned a lot and had as much fun with as I have with Dr. Sylk Sotto Santiago, Indiana University School of Medicine. Thank you so much, Sylk. This has been really great. I'll come back again sometime, okay?
Yes, anytime. This was a very pleasant conversation, and I am happy to have it again.
All right, folks. If you want it, you can get in touch with Sylk Sotto to learn more about #FailFest. We're going to post her paper, promotion accountability groups, and let's all think about ways that we can lead with wellness and equity. I love it. Love it. Great messages. See you all next time on the Faculty Factory podcast. Bye-bye for now.
Thanks for tuning in to Faculty Factory Podcast. The mission of the Faculty Factory is to build and support a community of leaders in faculty development who share tools, resources, wisdom, and encouragement in service to our faculty members, schools, and institutions. We encourage you to go to facultyfactory.org to find out more. Get in touch with me, ask me any questions. Maybe you want to be interviewed on the podcast. Thanks for tuning in to Faculty Factory Podcast. We'll see you next time. The Faculty Factory podcast and website is sponsored by the Johns Hopkins University School of Medicine Office of Faculty. For more information, visit facultyfactory.org.